Hello, and welcome to the webinar for the Pharmacy Quality Alliance Healthcare Quality Innovation Challenge, or HQIC for short. I'm happy that you could be joining us for this presentation focused for students to help you have a better idea of what the HQIC challenge is and how you can be involved in the semester ahead. My name is Chris Kochevar, and I serve as the Executive Fellow for PQA. And I want to give a quick plug for the Executive Fellowship. For those of you who may be in your final year of pharmacy school and are looking at what your next steps might be, if you're at all interested in associations management fellowships, certainly feel free to reach out to me. My contact information will be included later in this presentation, and I'm always happy to talk about what opportunities exist with PQA following graduation for student pharmacists. But the focus of tonight's presentation will be, of course, over HQIC. So to give us an idea of where we'll be headed with this presentation, we'll start off with just a brief overview summary of what HQIC is. We'll then talk about the timeline and what that looks like for the competition. We'll then get into what the team composition looks like, so the different individuals that you can have on your team for this competition. Finally, we'll talk about what a business plan is. It can be an idea of the different sections that are included within a typical business plan. And we'll finish out the presentation this evening talking about the prompts for this year's HQIC challenge. We'll finish out the presentation this evening with a question and answer session, but I do encourage you that throughout the presentation, if you have any questions, please put them in the chat box to ensure that they get answered throughout. I do want this to be an interactive session, and I know that with school starting back up for many schools and colleges of pharmacy in the near future, the last thing that we want is just to have another lecture going on. So please make this presentation as interactive as possible throughout. So moving into the HQIC, so the Healthcare Quality Innovation Challenge is an annual competition that PQA hosts in conjunction with an organization called Pharmacy Quality Solutions. For those of you that are involved in community pharmacy work, whether that's through internships or different APPE rotations, Pharmacy Quality Solutions is the company that puts out QUIP software. So if you're familiar with the QUIP software, I think that's their most commonly known software that they put forth for pharmacies to be using. And so that's PQS working in conjunction with PQA to put on this program to encourage quality innovation from students. So like I mentioned earlier, this is the 4th year that this competition is being run, and it's a team-based competition. So there's 3 different prompts that we have each year that we put forth, and you as a team are able to choose one of those prompts to put forth a business solution and put that together within a business summary proposal. From those business summary proposals that are submitted, we have a panel of judges from across our multi-stakeholder membership that puts on that judges each of these. And from that point, they select the top 3 teams, which then are asked to attend the PQA annual meeting to give their final pitch to another panel of judges as well. There's cash prizes that are associated with this as well. You can see here that the first place team receives a $5,000 cash award. The second place team receives $3,500, and the third place team receiving $1,500 as well. So what does this look like from a timeline perspective? Well, we're into August now, and we recently released the prompts for the competition. I'll show you later in the presentation where you can find those prompts online, as well as we'll briefly talk about each of the prompts. Between now and January is when you work through putting together the different pieces of the business summary proposal with your team. And I'll get to the team composition here in just a moment. But you have kind of the fall semester essentially to put this together in order to be submitted. PQA then works with our panel of judges to look at all the different proposals that come through. And on March 1st, we announced the top 3 finalists that then are asked to put together their presentation to submit by April 15th in order for us to have it ready to go for the May competition. And our annual meeting is typically held in the first half of May. And like I said, this live competition is a piece of that annual meeting. The teams themselves are made up of anywhere from 2 to 4 students. At least one of those students has to be a pharmacy student, but beyond that, there can be a number of different students that can be on the teams. And so you can have other pharmacy students. You can certainly have a team of 4 pharmacy students if you'd like. You can have other healthcare professional students, whether that's nursing or medical or otherwise, depending on who you may know, what other schools or colleges may be around at your university as well. You can also have business or engineering or computer science or other students. And so all of our prompts have to do with technology-driven solutions. And so that is where having another kind of major of student can come into play and can really be helpful to a team as well. In addition to the students that are on each team, each project has an advisor that's either from your specific university or is from a PQA member organization as well. If you have a question about whether or not a pharmacist that you're working with or another advisor that you're working with is from a PQA member organization, certainly reach out to me and I can help you kind of navigate that as well. So the application itself, as I mentioned earlier, is due on January 15th of 2021. The application includes a number of different pieces. Of course, the project title, the different prompts that you selected of the 3 prompts provided, which college or university you're from, the team captain, along with the other team members and their information as far as contact information goes, the team advisor and their contact information, and then finally 2 PDFs that go along with this. The first is from the college or university that's essentially saying that they approve of your participation and that if you're selected to come to the conference that to present your pitch, that they will help you in order to be able to attend the conference as well next May. In addition to that, we do have the business summary proposal that gets uploaded within this application. And so what does the business summary proposal include? So there's 7 different sections that are within the business summary proposal. The first is the executive summary. I like to always say that this is similar to an abstract if you're familiar more with scientific writing. And so of course, as it mentions, this includes the summary of the project as a whole in a brief format. The description of the problem, so this would come from the prompts that you select and any additional research with evidence that you conduct in order to make sure that you have a kind of sound understanding of what the issue is and then can go forward with how you're going to solve it. Looking at the description of the solution implementation strategy, so what specific goals you have with the product or service that you're putting forward, as well as a timeline and the different steps included in order to execute that product. So whatever the solution is that you come up with, being able to really put those into play and kind of mapping out what that looks like and how long it's going to take. Then you get into financial projections. So this would be something like a budget. And so making sure that you have the revenue or sales that you think would be incoming from that, what costs are associated with the service or product that you come forward with, as well as anticipated return on investment that is associated with this as well. Looking at the market analysis, so looking at kind of what competition, and this can come from the description of the problem as well and the research you do with that. What solutions potentially already exist out there? What makes yours different? Again, you look at something called the SWOT analysis, so the strengths, the weaknesses, the opportunities, and the threats. Is kind of the general analysis that you'll do with this as well. Looking at the marketing plan then, so how do you plan to get your product into the market? How do you plan to get it within, whether it's pharmacies or health plans or whatever level that you look at incorporating this into the healthcare systems in the healthcare as a whole? How do you plan to roll this out and increase its utilization? And finally, looking at potential challenges and solutions. And so what barriers do you think you may encounter and how do you plan to overcome them? So, this, as I'm talking through this, it may sound, like quite a bit. And I would encourage you to start with a few different places. Certainly, you can look around for different examples online as well. And the other spot that I would encourage you to ask around with would be with your management faculty for your College of Pharmacy. So if there's a specific faculty that works with the management course there, getting connected with them, and they can oftentimes provide some good resources to help get you started on this side of things as well. We do also ask that you limit these to no more than 12 pages. And so that's the total amount of pages, of course, that you can kind of look to kind of gauge how much information to be including within this as well. And I do see within the chat box that we had our first question come in about if there's any tips for how to get other students involved, such as business or computer science students. What I would say there is that, if you certainly have any connections from friends that you had met prior to being in pharmacy school, or even individuals that that perhaps have a minor in business or anything like that are within your pharmacy class, start by talking to them. And even if it's not them that's being involved, certainly they may be able to connect you with some other friends that they've met along the way that might be interested in participating with this. The other thing is, that if if you have a business school or college of engineering that includes computer science or anything like that. I know at SCSU, computer science fell under the College of Engineering, but if they have to do any sort of a kind of longitudinal type project that this could fit in with, it might be a good place to start with this as well. So you may be able to get more information on that by perhaps reaching out to one of the, either to your specific advisor in pharmacy that might know some of the advisors within the other colleges that would then be able to connect you with those students as well. So Mariah, I hope that helped answer your question there, to get other students involved here as well. So from here, looking at the different prompts that we have. And so I'll pause here for a moment. Is there any other questions on the program in general before we dive into each of the prompts that are put forth for this upcoming year? All right, I'll keep moving along, and certainly if you think of them as we move through here, don't hesitate to put those questions forth within that chat box. So the first question here, pandemics and pharmacies. And so certainly you can probably imagine where this one certainly came from, but the prompt here being develop a technology-driven solution that optimizes efficacy and safety in implementing a contactless pharmacy operation during a pandemic. I will encourage you as well I'll show you where the background statements are for these as well. There is more information included as to the context with these, but thinking about beyond just the COVID-19 pandemic, and if we were to experience another pandemic, whether it's on as large of a scale or a smaller scale, how you might implement a contactless type pharmacy operation and be able to kind of pull out those plans within any type of pandemic that would be occurring. There's another question coming in here as well about do students on the same team need to be from the same school, or could students from different schools work together as well? And I will say that historically we've had teams only submit from the same school, and so typically we do limit it to 2 to 4 students that are attending the same university, just for helping streamline that process as well. And so we do limit it, like I say, to students that are attending the same university. Great question there. Looking at our next prompt here, mental health and pharmacy. So develop a technology-driven solution that connects patients to mental health resources after assessing a patient's risk for mental illness. Potential disorders to address include, but are not limited to, and there's a number of them listed here as well. And so one thing for a background here, I will give for context as well, is that you can think about that your solution doesn't necessarily have to address each of these disorders listed. These are just examples that are given. So it's something to think about, that with whatever technology-driven solution you may come up with, as to which mental health disorders you may look to address with that as well. So hopefully that, again, gives you context with this one too. Another question that came in, can we see examples of previous year's proposals to have an idea? And this is a great question, and one I think that we get fairly frequently. I will say, so we do keep the previous year proposals private, just being that they were business ideas that were from students, and so could potentially be put into practice by them later on, or even early on within their careers as well. And so we don't have specific examples from previous years. But that being said, as I mentioned, I would look around online as well as talking with those faculty at your school, because there are a number of examples that you should be able to find just to see what a general business proposal looks like, which would be very similar to what you would be submitting here. So again, I can't provide specific examples from our previous years. However, I do hope that you are able to find those appropriate resources using, like I said, faculty from your college pharmacy, as well as looking around online. Great question there. Keep the questions rolling in, everybody. These are all very good. And finally, we'll look at the third prompt here, and this is bridging gaps in healthcare. And so developing a technology-driven solution that identifies and addresses a patient's health disparities based on social determinants of health or low social or economic status. So this prompt certainly, as we continue to look at health disparities that occur and how pharmacists can look to help have an impact on decreasing health disparities, is where this prompt evolved out of as well. And so encourage you to think about broadly kind of how pharmacists could have that impact on social determinants of health. So with that, I mentioned earlier that we have a website where you can find more information. So if you go to pqaalliance.org/student-programs, really if you remember pqaalliance.org, if you go to the top of the page, along the banner, there's an education tab, and under that education tab, you can click on student programs, and that'll have HQIC as one of the options within that page. Otherwise, if you can't find an answer there, always reach out to education@pqaalliance.org, and this is routed to our education team at PQA in order to get your question appropriately answered and hopefully help you stay on the right track. This is what that page will look like. So I wanted to give you an idea of the different pieces of information that you can find on this page. You'll notice in the upper right-hand corner, there's a full competition details link there. That is a 4-page document and includes much of what was in this presentation, along with some additional details, including the prompts and some frequently asked questions there. And so that's a good document to get you started as you look to begin participating in this program. The other important link on this page was this is where you come to submit your HQIC application, whether that be January 14th or December 14th. It can really be anywhere between now and January 15th that you submit whenever you're prepared to do so. So this is where you come to click on that Submit 2021 HQIC application link in order to submit that. And if you'd like to see the previous winners and at least the titles of their projects, you can find that under those HQIC winners links at the bottom there as well. So with that, we'll go in here to a final question and answer session. I'll give you all a few minutes just to digest a little bit of the discussion that we had here this evening. Again, these have been great questions that have been rolling in throughout, so I appreciate your guys' engagement. My contact information is also here. Feel free to reach out to me specifically with any questions regarding this presentation as well. All right, and not seeing any immediate questions come into the chat box. Again, thank you all so much for joining us this evening. I hope this has been beneficial in introducing the HQIC competition to you all. And again, I appreciate your time. There is one more question here that we have coming in as we finish up. The question is just to confirm we can work with students of any major graduate or undergraduate, etc. And that is correct, yes. They do not have to be specifically undergraduate or graduate students. They can be across any student that you may find that can have meaningful contribution to your project. It is more than welcome to participate as long as one of those students is a student pharmacist. Great question there. All right. And seeing no other questions come in, again, thank you all for joining us this evening, and don't hesitate to reach out with any additional questions you may think of. Have a good rest of your night.